What's up guys, it's Rio. Today I'm going to talk about American healthcare, and it's a big topic, and I will talk based on what I know and a little bit of comparison between American healthcare and Japanese healthcare. So let's begin. So I've been in LA for about 12-13 years now, and I've never had a healthcare other than the one that I got from the college while I was in college. Some sort of small insurance that they provided. I don't really remember, but I had something while I was in college. But other than that, basically no healthcare at all the entire time. And some of you might know, most of you probably don't, but I have my own business here, and it's been about 8 years or so now. And I decided to let it go and go back to Japan sometime next year. And there are multiple reasons why I decided to do that, and I will make a separate video why I decided to do that. But one of the reasons why I decided to do so is the healthcare. So I never really thought about getting one up until a few years ago. Because of Obamacare, people basically have to pay a penalty if you don't have a healthcare once a year. So I was doing that for a while, and then a few years ago, at some point, I decided maybe, okay, I should check out what they really have, because I've never even did any research. So I did that about a few years ago, and they gave me multiple options, but like the cheapest plan was about a couple $100 or so a month, and which is about a couple $1,000 a year. But for that, what I would get was basically like $5,000 deductible, and then after that, like maybe 20% support by the health insurance, but 80% on my own, kind of like that. And then the more expensive the plan, the better support you get by the insurance, obviously. But even like one or few better plans, they looked pretty similar. So for those of you who don't know what deductible means, but the deductible is like basically if $5,000 deductible, meaning up to $5,000, it's all you. Health insurance don't help you at all. Up to $5,000, it's out of your pocket. And then anything above $5,000, they finally start helping you, but still up to, let's say, like $8,000 or so, they help you with just 20% of the cost, and then so 80% by yourself. And then above that, maybe they will help you a little more, like 40%. So that's what I was offered when I did the little research a few years ago, and I was really shocked, to be honest, because if it's $5,000 deductible, like what's the point? Like unless I get something big, something costs me like $10,000 or something, it basically doesn't really do anything. I just can't go see a doctor for something small. You just can't use the health insurance. So like it's all basically all on you. So I thought that was such a waste of money, and so I thought it's better for me to just pay the penalty for like $1,000 or so, whatever, a year, instead of wasting a couple of $1,000 that's not really helpful. And I have a friend who, a husband and wife who own a restaurant, and they have a health insurance, and they pay $2,500 a month together for both of them, which is a lot. $2,500 a month, which is about $30,000 a year. But what they told me was really shocking, because paying that much of money for the insurance, it doesn't really do anything. So the husband got a cut on his finger, injury that needed to be stitched, and apparently it costed about a couple of $1,000. And then that was completely 100% out of his pocket. Because apparently, even though they're paying $2,500 together, so I guess like $1,250 each, $1,300 each, it just doesn't cover anything up until their deductible is $2,500 or $3,000 or something. So when he got cut, injury, needed to be stitched, he had to pay on his own. The health insurance he has that he pays $1,200, $1,300 a month just did not do anything for this injury. And then another time, he apparently has some sort of trouble with his eyes, and he had to get a shot on his eyeball, and that apparently costed again a couple of $1,000s, again 100% on his own. When they pay like together though, but like $30,000 a year, and it just doesn't help them at all. But in the meantime though, okay, so there are some friends that I know who work for good company as an employee, not like employer, compared to the restaurant owners that I just mentioned. So these guys that I know who work for a big corporate, they get a really good deal. One of them I know pays about $150 a month, which is apparently $700 a month plan, and there's no deductible. So anything that he needs to go to the doctor, basically it's all covered. So I was really surprised with that. And then another friend also doesn't pay anything. Company pays all the coverage, and I don't remember the details, but his plan was also really good. So what I'm trying to say today is that as of 2017 summer, it is really difficult to cover yourself if your company doesn't support your health insurance. So if you're a part-time worker or if you have your own business, it is really difficult to get a good deal of health insurance. But if you work for a big corporate, they got hundreds of or thousands of employees. So I guess it's easier for those companies to get a better deal on each worker. So based on my own research, it looks like it's definitely a better idea to work for big companies. So like basically what I'm trying to say is that if you work for a big company, you're lucky, great, you get a good coverage. And if you don't, forget it, because it's just not worth it. If you try to get yourself covered, what you will get is just crappy options. To be honest, from my own research, that's what it looks like. And one more thing about American healthcare that sucks is that there are a list of hospitals and clinics that you can go with that specific healthcare that you have. So it's not like you can go to any hospitals or doctors. Your options are limited. So the first question that they ask you in American hospital is that, which healthcare do you have? And like, no joke, because that's what matters. I thought it's a good topic to share, even for the people who live in America, but also who are outside America planning on coming to America, maybe trying to study, work, whatever the reasons that you guys have. But I think it's important to look at the realities too, not only looking at good things, but also you should consider or keep in mind that there are some important things to know also ahead of time. So like I said in the beginning of this video, I wanted to talk about a little bit of a difference or comparison between American healthcare and Japanese healthcare. So in Japan, Please correct me if I give any wrong information because I've been away from Japan for a while. But from what I know, in Japan, it's a mandatory government-owned healthcare. Everybody has one, and then everybody has the same healthcare basically. And then good thing about Japanese healthcare is that you can go with this same healthcare that everybody has. You can go to any doctors, any clinics, and it covers from head to toe, like eye doctors, dentists, to like regular hospitals and clinics and all that, except for like plastic surgery and stuff like that. But in general, all the medical costs are covered by 70% by the government, so you only pay 30% on every and any visit. There's no such thing deductible. I used to pay like a couple $100 a month or so. That's probably based on your income too. Healthcare was not really necessary when you were young, obviously, but when you start getting older, you start feeling sort of basically insecure, uncomfortable not having healthcare. And I started feeling very uncomfortable with the situation. Whereas in Japan, for something very little, you can go see your doctor. But here, if you hesitate to go see a doctor for a long time, that little problem can become a very big problem and can be too late. And I was thinking, like, how Japanese have like one of the longest life expectancy, and when I learned about Japanese healthcare, I was like, okay, this could be one of the reasons why that Japanese people have one of the longest life expectancy, because Japanese people always go see a doctor for even something small to, to confirm that there's nothing wrong with it. So it's always a better chance for them to find a small problem in the early stages. Whereas in America, there are a lot of people who don't have healthcare, hesitate to go see a doctor for something small, and tend to become a bigger problem in a lot of cases too late. So that, I thought, could be another reason why maybe Japanese people, or in the countries where there are good healthcare, might have a better, longer life expectancy because of that. But like I said, if you are working for a big corporate, you guys are probably thinking like, what are you guys talking about? Like, I have no problem with my healthcare, I'm sure like you have nothing to do with what Donald Trump is trying to do and whatever. But even if he comes up with something better, or it doesn't have to be Donald Trump, maybe someone after comes up with something better than what it is now, I still don't think it'll get to the level of what Japanese healthcare is. So for me to live in Japan is a lot safer option, I think. I think that's about it today. Like I said earlier, if I gave any wrong information, please correct me, or like if there's anything that you want to add, please write in the comment down below. Thank you for watching. Have a good one.